Hi there, and thanks for joining us. I'm Connie Tran. Receiving a cancer diagnosis can be extremely overwhelming on its own, but when that diagnosis decreases the chances of having a family in the future, that can add even more stress. We met a woman in her mid-30s who was diagnosed with breast cancer just a few months ago, and she doesn't have children yet. Her chemotherapy treatment could have ended all hope of family planning, but not anymore.
Hello, how are you?
Though Lorena Porqueras has breast cancer, this doctor's appointment is not with her oncologist.
So what's the next step now?
She's meeting fertility specialist Dr. Carolina Sueldo at the Women's Specialty and Fertility Center at Clovis Community Medical Center.
I'm young. I haven't gotten married yet. I do want children.
Dr. Sueldo is board certified in reproductive endocrinology and infertility. She says young cancer patients are now given the option to freeze their eggs before they undergo chemotherapy or radiation. Sueldo says it's a discussion that wasn't talked about in years past.
We see time and time again where they wish they would have known. They wish they would have had that conversation, and we're then trying to kind of play catch up after the fact.
Dr. Sueldo explains cancer treatments can damage a woman's eggs, therefore affecting her fertility.
There may have been an impact to the ovaries, specifically to the egg reserve or the egg supply, that may not be recuperable.
So Lorena, who is in her mid-30s, decided to take control of her future and created an insurance plan.
Started the fertility treatment, which meant first taking pills and then injecting my tummy for 10 days.
She underwent the egg retrieval process.
I actually got 29 mature eggs.
All of those eggs brings Lorena one step closer to being a mother one day.
The eggs would be unthawed, or they would be defrosted or thawed, At that point, they would be combined with the sperm to form embryos. They would be grown in the incubator approximately 3 to 5 days and watched during that process.
Dr. Sueldo says when Lorena is done with cancer treatments, healthy and ready to go, her embryos will then be transferred into her uterus. And if all goes well, she may get pregnant. It's hope that helps Lorena fight through her breast cancer diagnosis.
It's amazing. I'm very grateful and blessed that I came here to Clovis.
It's that faith that Dr. Sueldo wants all young cancer patients to have. She says it's all about giving them options.
Before, we were a little more limited in terms of the options that we were able to offer, and I think this is something that's really special in terms of looking ahead and giving hope for the future.
Now Lorena is focused more than ever to beat cancer and be a mother one day.
My eggs are now here, frozen, and each time I pass by, I kind of wave and say, maybe we'll meet in the future.
Dr. Sueldo says there are other fertility options for patients prior to starting cancer treatment. Egg freezing is just one of them. For more information, visit the Women's Specialty and Fertility Center's website, WSFC.com.